All right, good afternoon, good morning, classmates. We will be presenting to you our hot topic of non-communicable diseases. My name is Amy Nguyen, and then we have Cassie Rosette and Honey Patel. So we'll be going through non-communicable diseases, the global perspective, the causes of deaths and the death distribution worldwide, global burdens of disease in both high, middle, and low income countries, the leading causes of death. We'll review briefly risk factors, non-communicable disease organizations, critique of the global systems, and priority areas of action. So non-communicable diseases are the leading causes of ill health around the world and account for 7 of 10 deaths, or about 73% of deaths globally. Non-communicable diseases, mortality is higher in our low and middle income countries, and at least in high income countries in people with lower socioeconomic status. Historically, non-communicable diseases have dominated in our high income countries, but we have been seeing in recent years a shift in our lower and middle income countries from communicable diseases to our non-communicable diseases. So these are definitely an important obstacle for reducing global and national health inequalities. So when we look at the number of deaths by cause worldwide, we see that communicable diseases or non-communicable diseases are the majority of the causes of death, followed by communicable, maternal, neonatal, nutritional, and then lastly, injuries. So as we make progress in fighting against our infectious diseases, as well as our population ages, we'll see that non-communicable diseases are expected to continue to increase as our leading causes of death worldwide. Here we can see number of deaths by causes. Cardiovascular disease is our leading cause of death globally, and cancer is right behind it as the second biggest cause of death. And approximately 70% of deaths from cancer occur in our low and middle income countries. So looking at this information from the Institute for Health Metrics and Evaluation on global burdens of diseases, we can see the top causes of death in our high and middle income countries and compare back in 1990 to 2019. So we see in 1990, the top 3 causes of death in high and middle income countries were our non-communicable diseases. But then by 2019, our top 6 causes of death were all non-communicable diseases. We can also look at our disability adjusted life years, or DALYs. So because we're having increased aging population, we see compared to 1990, where the top 3 causes were non-communicable diseases, now our top 6 causes of DALYs are non-communicable diseases. And this is because we have more people living with these non-communicable diseases. So taking a look at our low and middle income countries' causes of death, in 1990, out of the top 5, we only see 1 non-communicable disease. The rest are all communicable diseases: respiratory infections, TB, maternal, neonatal, enteric, and other infections. Now, fast forward to 2019, our top 3 causes of death are now non-communicable diseases. What I find interesting, cardiovascular disease was the only one ranked number 2 in 1990. That moved up to number 1. We then see cancer or neoplasms move from number 7 to our 2nd leading cause of death, and chronic respiratory diseases move from number 6 to number 3. So this shows that this trend is likely to continue. So we need to focus on our management of non-communicable diseases. So as previously said, non-communicable diseases are the leading cause of death worldwide, and this does vary between countries and regions. We do see in some of our low-income countries, especially sub-Saharan Africa, that communicable diseases do still lead as the cause of death. However, we'll see in our next few graphs that it is starting to decrease. In our lower middle income countries, we've seen a positive shift from communicable diseases being the leading cause of death to now non-communicable diseases. And then we'll see a big difference when we get to our upper middle to high income countries where non-communicable diseases kind of dominate over communicable. So this graph here shows us the trend from 1990 to 2017. So sub-Saharan Africa, we see back in 1990, the communicable diseases were the leading cause of death, about 70% of those deaths. However, in 2017, it has decreased to 58% of deaths being caused by communicable diseases. And we see an increase in our non-communicable diseases from 24% to 34%. So although communicable diseases still cause the most deaths, it is starting to decrease, and we're seeing a trend of non-communicable diseases taking over. Then we have a few other low-income countries I wanted to show just the difference. In Yemen, back in 1990, communicable diseases were the top cause of death. However, now looking at fast forward to 2017, a clear shift in non-communicable diseases. About 55% of deaths were caused by non-communicable diseases, and our communicable diseases were only accounting for about 25% of deaths. And then another similar statistics is in Bolivia, just showing that how the majority in 1990 of our deaths were by communicable diseases, and how we've shifted again to non-communicable diseases kind of taking over as the leading cause of death. So now we're looking at our more lower middle income countries. India here, we see again a similar trend. So in India, the leading cause of death in 1990 was communicable diseases at about 48%, and and in 2017, the leading cause of death is now our non-communicable diseases at about 70%. And then we see a very big difference here when we get to our upper middle income countries such as Russia, China, Brazil, and our high income countries such as Canada, the United States, and Australia. Communicable diseases, and you could barely see them. Non-communicable diseases are clearly the leading cause of death in these countries, even in 1990, and they continue to rise in 2017. So why do we see these disparities? It mostly is due to our leading risk factors that contribute to these deaths. So in high income countries, you see that the dominant risk factors are more behavioral, such as healthy diets, smoking, alcohol intake, physical activity. In contrast, in our lower income countries, our risk factors include child wasting, unsafe water, poor sanitation, household air pollution, and lack of access to hand washing facilities. And then specifically in some South Africa, Kenya, we see unsafe sex leading to HIV and AIDS as the leading causes of death. So this is what we can see is causing most of these disparities is our risk factors.
Next, we will discuss non-communicable diseases and organizations that are targeted at creating action plans to address the problem of increased rates of non-communicable diseases globally. So first, we have the Non-Communicable Disease Alliance, and this agency represents the 4 main non-communicable diseases it being experienced globally, which would be cancer, cardiovascular disease, chronic respiratory disease, and diabetes. So why is this agency beneficial or important? So many of the NCDs being experienced can be prevented by 4 major risk factors that drive these diseases, which include tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. So the goal of the NCD Alliance is to prioritize NCDs politically and increasing civil society commitment to change the future, and also to create prevention and control strategies. Next, we have the United Nations, which is an international organization founded by over 50 countries. And the United Nations is beneficial to targeting non-communicable diseases by committing and coordinating international cooperation on health issues. So this means creating plans globally, countries working together to try and decrease the rate of non-communicable diseases. In addition, the UN actively promotes good health. Moving on to the World Health Organization. The World Health Organization coordinates and directs authority for health within the UN system. So these two go hand in hand. The World Health Organization is responsible for providing leadership on global matters, shaping health research agendas, setting norms and standards for quality of life, articulating evidence-based policy options that target these high rates of chronic illness, and providing technical support to countries, along with monitoring and assessing health trends. So the World Health Organization does a lot as far as monitoring and suggesting plans to target non-communicable diseases and the high rates being experienced, not just in high-income countries now, but low and middle-income countries. Next, we have the Lancet, which is an informal collaboration of academics, practitioners, and civil organizations. So this is a non-communicable disease action group, and their main goal is to gather information to change current policies. So creating policies aimed at preventing and treating non-communicable diseases is especially important for the Lancet. And they typically focus on low to middle income countries. Along with the 4 agencies we just discussed, there's also the NCD Child, Center for Global NCDs, Organization for Economic Cooperation and the Development, the Union, and NCD Free. And all of these, again, just focus on decreasing these high rates and high mortality rates of non-communicable diseases around the world. Next, we will discuss the global systems and critique them. So first, we have low levels of health education and health literacy. So with this can cause less compliance and plans and strategies to decrease the rate of non-communicable diseases. So creating strategies to decrease the rate of non-communicable diseases nationally and globally is extremely important. However, if individuals not fully understand the steps they need to take or the importance of the steps taken, they may not adequately be able to engage in policies created in their community. So an example of this, a patient diagnosed with type 2 diabetes, say they're very well educated on the risk factors and what they can do to maybe manage their health a little bit better, is going to be more successful in management than an individual who is diagnosed with type 2 diabetes and has no idea the cause or risk factors that could have led to the diagnosis, or the treatment and why treatment is important, which treatment is important because it can decrease chances of complications later on. So another issue with low levels of health education and health literacy includes cultural differences, which can impact an individual's likelihood to engage in lifestyle changes. So making diet recommendations may not be beneficial to certain communities due to traditions. Next, we have a lack of recognition of the social determinants of health experience. So currently in the United States, the underlying social determinants of health are not being addressed when discussing non-communicable diseases. So social determinants of health, such as access to healthcare, could be discrimination and racism, or even language and literacy skills, can unfortunately drastically impact a person's likelihood of developing a non-communicable disease, meaning the root of many non-communicable diseases are not being recognized or addressed. An example of this would be inequalities in social conditions experienced from birth to adulthood. So say an individual growing up in a community, low income community, is exposed and not educated on risk factors, may grow up being involved in things that could drastically increase the rate of non-communicable diseases or the likelihood of developing a disease later on. And next, we have a lack of research and funding. So further research into the risk factors associated with NCDs, along with innovative interventions to address the risk factors, is needed. So addressing trade and intellectual property concerns in order to continue NCD research and development efforts while expanding the availability and affordability with access to medications, diagnostics, and treatments in both developed and developing countries. Along with this is funding for non-communicable diseases is much lower than funding for infectious diseases. So in the US especially, although NCDs have been addressed more in the recent years, funding for non-communicable diseases is much lower compared to infectious diseases. This can be a problem globally because funding for NCDs remains low compared to other diseases that are considered quote unquote high priority. So an example of this would include a need to finish infectious diseases agenda such as HIV. So focusing on decreasing the rate of HIV while ignoring cardiovascular disease or diabetes. So before they can fully commit to NCDs, many agencies or funding for research is not being targeted towards non-communicable diseases.
So given these issues within the organizations and countries working on non-communicable disease reduction, we will now look at the priority areas for action that they can take to improve their strategies. So first, on a global level, the WHO and UN need to formally recognize and prioritize non-communicable diseases as an urgent international health issue. Once they do this, they can design and implement policies in conjunction with other organizations and national governments to reduce the burden of NCDs worldwide. The first step of this strategy would be to assess the prevalence of NCDs to keep track of higher priority regions where there's an increased burden, which can be accomplished through research collaborations among these agencies and institutions. In particular, more research is needed in lower and middle income countries because although higher income countries tend to have more well-funded institutions that are capable of conducting this research on a bigger scale, the distribution and the causes of NCDs in the lower and middle income countries are different from those in higher income countries, so it requires separate research. For example, certain types of cancers are more common in lower and middle income countries, such as gastric and cervical cancer. And there's also a higher burden of infectious diseases in lower and middle income countries, which contributes to a higher risk for some types of NCDs. And this can be due to issues such as immunosuppression from the infectious diseases. This is especially troubling because the probability of dying prematurely from NCDs is fourfold higher for people living in low and middle income countries than in high income countries. Therefore, further research is needed to understand the true burden of NCDs, not only in lower and middle income countries, but worldwide. And once this first step is taken, these organizations and countries can begin addressing NCDs in a more efficient and effective way. The second priority area for action is to increase health literacy and education related to NCDs. Organizations and governments need to inform individuals and communities of the steps they need to take to combat NCDs at the individual and local level. According to a study published just this year, high health literacy level is a critical component to lower risk of developing NCDs. Empowering patients to play a more active role in their health can lead to lower disease impact and equip them to manage chronic conditions more effectively. In addition, the promotion of health literacy can be particularly helpful for addressing NCDs that are associated with behavioral risk factors, such as substance use and unhealthy diets. And some of these potential interventions can include health literacy programs to improve disease knowledge, promotion of medication adherence, education for a healthy diet and exercise, smoking cessation programs, and mental health interventions. And some other examples of potential interventions could include petitioning food industries to reduce salt content in food that they distribute, creating robust school health education programs, and increasing home health visits in countries where healthcare might not be easily accessible. And the third priority area for action that we recommend is increased funding for implementation of the NCD programs that we've discussed so far. So there's a substantial financing gap for lower and middle income countries for the implementation of these programs, especially in the context of universal health coverage. The WHO Independent High-Level Commission on NCDs recommends higher percentages of national budgets to be allocated for health, specifically towards NCDs and mental health. And they suggest that this should be financed partly through higher taxes on tobacco and alcohol, which will also help with reducing NCDs that may be caused by these substances. The international community should increase financing and lending for the prevention and management of NCDs. And in order to make these changes on a large scale, improved allocations for primary healthcare systems should also be implemented. This will help increase access to care and aid in increasing preventative health and health education, which will in turn allow progress on the second priority area that we talked about, which is health education related to NCD. And preliminary data from a World Economic Forum sponsored study estimates that $35 trillion of global economic output loss will be generated from 2005 to 2030 due to diabetes, heart disease, breast cancer, and COPD, which are all NCDs. And these findings indicate that the economic burden from these diseases will evolve into a staggering economic burden over the next 2 decades. And it could greatly impact development and take away funds available to fight other issues such as poverty. So it's very important that global organizations and governments invest now to prevent future economic losses and deaths due to NCDs. Thank you for listening to our presentation, and we look forward to answering your questions.